Hello, everyone. My name is Al-Dhaher. I'm a family physician with the Central Lambton Family Health Team, and it's my pleasure to do this video as part of our series from our clinic to the community to get a better understanding of the COVID-19 pandemic and ways that we can protect ourselves and each other in order to flatten the curve. The topic that I was asked to talk about is social distancing. And social distancing is a very important concept, especially in light of how fast this virus is spreading. Make no mistake, this virus is out there in Lambton County. It's just a matter of time before we have our first documented case. And the problem with this virus is that not much is known about it, but it does act a lot like SARS. It's part of the coronavirus family. It's a respiratory virus. It attacks the young and the old, and for the vulnerable, for the elderly, for people who have multiple medical illnesses, as well as the young. We're seeing that males and females of all age groups are entering the hospital and are going into the ICU and are experiencing a tremendous amount of difficulty with breathing. And so this is going to cause a significant limitation to our available resources. If we start with one case and going by the projections and the forecasting, this one case can lead to several, and those several can lead to several more. And pretty soon, our ICU in Blue Water Health will be very limited with its resources as far as beds, nursing, and ventilators. And not only is that problematic, but as time goes on, there will be more people who need to use the ICU and unfortunately won't have the place or the resources for it. And people who have other medical conditions that need the ICU will unfortunately be faced with a dilemma as to where they can be looked after. This is a very, very serious issue. And this is why I've been tasked to talk about social distancing, because we have a choice. We can either do nothing about it and let this virus roam and hit us very, very hard and affect my colleagues, my friends, myself, and the people that I care about, like my patients, but all of us as a community. We can let that happen, or we can try to flatten the curve. So what does flatten the curve mean? Flattening the curve is basically trying to prolong the exposure, but to decrease its intensity so that over a prolonged period of time, we have a better handle on controlling this virus. And that takes into measures that sound difficult, sound a little bit unusual, because these are unusual times, but unfortunately they are necessary. Social distancing is one of these measures. So what social distancing means is that we have to try to stay home as much as possible. And I'm going to repeat that again. We have to stay home as much as possible. Any unnecessary trips or outings should be reconsidered. If we have to go and grab groceries or medications or whatever, you have to go out and pretend that other people have the virus. So you have to be very careful with touching handles, door handles, going in and out of the store. You have to assume that the person next to you may be sick, because a lot of people are sick and they don't even know it. And so you have to maintain a safe distance of 6 feet or 2 meters. Unnecessary trips to Tim Hortons, finding out what Judy and Dawn are up to. Unfortunately, that's going to have to take a back seat to public safety. And I know the province has mandated that gatherings of a certain number are the max. That doesn't mean that you can have dinner parties or get-togethers or dinners and you can invite that many people. All that means is if you must go to a grocery store, their limitations is X number of people. The best rule of thumb that I would say is think of yourself as having the virus. That way you try to stay in as much as possible and limit the damage that you can cause, and pretend that other people may have it so that you can take the necessary precautions. Precautions like aggressive hand washing with soap and water for at least 20 seconds. Trying to avoid touching your face. trying to staying home and working, staying home and doing work from home. This is a very serious virus. It's causing havoc in Europe. There have been a lot of deaths of elderly, of immunocompromised, but even the healthy and healthcare workers. And right now in Canada, we're on the verge of following the trend. We have to do what is necessary. We have to flatten the curve. We have to exercise caution and be smart and try to do what's best for our loved ones, our neighbors, our friends, and our family members. So, as a physician and as somebody with a young family and elderly parents, I implore you, please, please try to stay home as much as possible. Try to avoid any unnecessary outings. Be kind to one another through mobile devices, through phone calls, checking up on your neighbors and seeing how they're doing without any touch or facial contact or what have you. And please, please exercise social distancing. Now it's more important than ever. Thank you very much. This message is a reminder to me and hopefully to you. And I hope that together as a unified community, we can get through the next several weeks that are sure to be difficult. We can get through them safely, and that we protect our healthcare workers and we protect our loved ones. Take care. Have a good day.